Welcome, class. Today we will be covering a nursing assessment and care plan. Our patient is Mrs. M, and she's an 85-year-old married female. She complains of chest pain and nausea and fatigue. For Mrs. M, we will old cart her symptoms. Her pain started this morning. The location of her pain was in her chest. The pain was ongoing. It felt like an elephant was sitting over my chest. The aggravating factors were excursion and stress. Relieving factors were rest. She tried Mylanta, but this was not helpful.
Mrs. M's previous health history included hyperlipidemia, which is elevated lipid levels. Her previous history is a likely clue because high levels of cholesterol can reduce blood flow in the arteries, causing complications of ineffective cardiopulmonary tissue perfusion and chest pain. Mrs. M's objective data included elevated cholesterol levels of 250, high blood pressure of 185/95, and slightly irregular and rapid heart rhythm. Her nursing diagnosis we came up with from these symptoms was an ineffective cardiopulmonary tissue perfusion related to interrupted myocardial arterial blood flow, as evidenced by 7 out of 10 chest pain.
Let's make Mrs. M better by setting goals and interventions that will help her cardiopulmonary tissue perfusion problems. Our first short-term goal is that Mrs. M will have improved cardiopulmonary tissue perfusion by the end of the shift, as evidenced by less than 7 out of 10 pain. The first intervention is to administer nitrates and anti-anginal agents as prescribed. The rationale is that these medications will dilate blood vessels and increase coronary arterial blood flow. This will improve cardiopulmonary tissue perfusion.
Our second intervention is to monitor pain every 1 to 2 hours until pain diminishes. Angina is caused by inadequate cardiopulmonary tissue perfusion. Reduced chest pain can indicate improved tissue perfusion. The third intervention would be to give Mrs. M oxygen. Supplemental oxygen increases oxygen available to Mrs. M's cardiopulmonary tissues. The long-term goal for Mrs. M will be to have adequate cardiopulmonary tissue perfusion by discharge.
Our long-term goal intervention 1 is to monitor Mrs. M's blood pressure every 2 to 4 hours. The reason for that is that the blood pressure reflects the level of cardiopulmonary tissue perfusion. Intervention 2 is to monitor arterial blood gas as ordered, because the ABG levels show level of oxygen delivery to cardiopulmonary tissues, which can clue on what Mrs. M's cardiopulmonary perfusion status is. Intervention number 3 is to keep Mrs. M in a semi-Fowler's position. Keeping her in that position will reduce the workload on Mrs. M's heart.
So let's see how the interventions worked. Mrs. M met the short-term goal of having less than 7 out of 10 pain when she told us that she now has 4 out of 10 pain. Mrs. M also met the long-term goal of having no pain at discharge. So Mrs. M gets to go home feeling better. But we also want her to stay well. So we want to educate her about the importance of reducing her intake of foods high in fat and sodium, reducing her caffeine intake, and keeping a food diary. Let's hope Mrs. M doesn't have to come back in for chest pain, but if she does, let's hope she comes in as soon as she feels it.